So thank you for having me here. Today I will present a joint model for reconstruction and segmentation using Bregman iteration. All imaging modalities such as MRI, PET, CT require an image reconstruction approach to produce the final image. In many practical applications, these images are then used to extract specific information such as boundaries of regions of interest. In this context, image segmentation methods are then applied a posteriori to the reconstructed image. In this talk, we will present a method that solves both tasks in a unified framework. We will propose a variational formulation of the joint problem, in which the idea is to regularize the reconstructed image U in an adaptive way according to the segmentation. So in this formulation, we can see that we have the block for the reconstruction, in which we aim at recovering the U, giving some data F, and in case of MRI, such as in the example I will show later, the forward operator is the subsample Fourier transform. We impose regularity on U by using the edge-preserving total variation controlled by the parameter alpha. So in the second block, we are solving the segmentation problem, in which we seek a partition of the reconstructed image U in regions that have mean intensity values close to this constant C. Again, the regularization is the total variation, which penalizes the length of the contour of the segmentation, and the parameter beta controls the scale of the object to be segmented. In addition, we have this parameter delta, which controls the effect of the segmentation in the reconstruction in terms of imposing sharp edges of regions of interest. However, we will consider a variation of this of the previous formulation, and we will extend it to a Bregman iteration scheme, in which the total variation regularizers are replaced by their Bregman distances, which is defined here for a particular subgradient. This alternating iterative scheme allows us to solve the joint problem by iterating along specific regular solution paths, which are imposed by the regularization. So in this formulation, we then can compute the update for the subgradients conveniently by computing the optimality conditions. Due to noise in the data, we need to stop these iterations at a suitable point. And just to mention briefly that this problem is overall non-convex, but we will exploit convexity in each individual variable, and under suitable assumptions, we can show global convergence of the iterates. So we'll just quickly present some results. This is for, as I said before, for MRI. This is just a brain phantom, and I will compare the results for the traditional sequential approach by using total variation reconstruction or enhanced total variation with Bregman iteration. And on the right, in this column, we can see the results for the joint reconstruction and segmentation. As you can see, the small finer details are recovered by the joint approach compared to the sequential approach, and the segmentation as a consequence is also improved compared to the traditional sequential approach. These results is for real MRI data acquired at Cancer Research in Cambridge, and here you can see a slice of the head of a rat, and this part is the brain, and the brighter part is a tumor. So we will we will take from the Fourier space 15% of the sample, and we will compare again the total variation reconstruction and the Bregman reconstruction and the segmentation with our joint approach. If we look at a zoomed section, we can see that our joint, although the segmentations are actually quite similar, the reconstruction looks more clean, and more importantly, we can see that we have a reconstruction with enhanced edges. To summarize, this joint approach solved both tasks simultaneously, and for the numerical framework, we can actually show global convergence, and yeah, come to the poster for the details. in general, we have shown that solving both tasks simultaneously is actually convenient compared to the traditional sequential approach. And in particular, we're not able with this approach to perform, to obtain reconstructed images with enhanced edges. Thank you.